This video offers a summary of the research article titled Non-Trauma Focused Meditation versus Exposure Therapy in Veterans with Post-Traumatic Stress Disorder, a randomized controlled trial. This project was conducted by investigators from the VA San Diego Healthcare System, the University of California, San Diego, and the Maharishi University of Management. This article was published online by the journal Lancet Psychiatry on November 15, 2018, and the study was supported by a grant from the Department of Defense from 2012 through 2017. Post-traumatic stress disorder is among the most common mental health condition affecting military veterans, with a prevalence of 15 to 20% found in different studies. PTSD can result from both combat experiences and non-combat experiences in veterans, and there are several established treatments for PTSD that use techniques from a treatment paradigm called cognitive behavioral therapy, such as a treatment called prolonged exposure. Prolonged exposure is very effective on average, and many veterans experience marked improvements in their PTSD symptoms. However, it is also well known that a substantial minority of veterans do not respond well to prolonged exposure, suggesting a need for additional treatment options. Transcendental meditation was the new treatment of interest in this study for a couple of reasons. First, there are many individual studies using TM that support the benefits of this meditation practice for reducing mood and anxiety symptoms. And there are also meditation reviews that combine results from across separate studies that are also supportive of TM for reducing negative emotions. Secondly, transcendental meditation offers a complementary approach to prolonged exposure in treating PTSD that we believed might make it an effective alternative. Prolonged exposure tends to be most difficult at the beginning of treatment, as the patient begins a practice of regular in-person or imaginal exposure to elements of their trauma that can, at least initially, produce increased anxiety. Transcendental meditation works in the opposite way, teaching a patient how to achieve a deep state of relaxation that reduces arousal and anxiety symptoms. For this reason, we hypothesized that TM might be easier to adopt as a treatment for PTSD, and otherwise perhaps be equally effective overall as prolonged exposure. This study used a research design called a comparative effectiveness design. In a typical randomized control trial, a researcher compares their treatment of interest to a soft alternative treatment such as usual care, a waitlist control, or a placebo therapy. These latter soft treatments are not expected to be particularly effective and therefore make it easier to establish that the new treatment of interest is more effective in comparison. In a comparative effectiveness design, however, the comparison is a hard or gold standard treatment. The goal is to see how the new treatment of interest fares in comparison to the best treatments available. Although a comparative effectiveness design uses a much more difficult comparison standard, the advantage is that the researcher gets a clearer sense of how useful the new treatment might be in clinical practice. For this study to offer meaningful results, we needed to make the treatments as comparable as possible. In both the PE and TM treatments, we had trained practitioners providing the treatments over a 3-month, 12-session protocol. This meant that veterans receiving either treatment received the same amount of treatment over the same amount of time. We also took steps to ensure that the treatment providers were comparable to reduce the risk of finding results that reflected, say, some skill advantage of the providers rather than reflecting the actual effects of the treatment. Our TM providers, for example, had no prior experience with PTSD or veteran populations, but did complete officially sanctioned training for teaching TM. Similarly, our prolonged exposure therapists were trained according to nationally recognized standards for clinicians using prolonged exposure in VA hospitals with veterans, but did not have significant prior experience with PTSD or veterans. We also compared the veterans and these two treatments on the same gold standard PTSD and depression measures. Here we see some of the central results of the study. Both prolonged exposure and transcendental meditation were effective on average, helping reduce both PTSD symptoms and depression symptoms. There were no overall significant differences between the TM and PE groups on either of these measures. However, both treatments had variable benefits across individual veterans, with some veterans experiencing large symptom improvements and some veterans experiencing only relatively small changes in their symptoms. The veterans that completed either prolonged exposure or the transcendental meditation treatment, perhaps predictably, reported more improvements on average than veterans that ended their treatments early. In this study, PTSD symptoms were measured using the clinically administered PTSD scale, often abbreviated as the CAPS, a standard interview for measuring PTSD symptoms, along with the PTSD checklist, abbreviated the PCLM. We measured depression using the Patient Health Questionnaire 9, abbreviated here as the PHQ-9. This slide shows some temporal patterns of symptom changes in the groups over time on the PCLM measure of PTSD symptoms. The patterns here are interesting because they suggest that veterans receiving the prolonged exposure therapy experience relatively gradual reductions in their PTSD symptoms across the course of treatment, whereas veterans receiving the Transcendental meditation training experienced more rapid initial symptom reductions and only small subsequent improvements. Let me close over the next couple of slides by offering some thoughts about future research and clinical applications. Firstly, this study can only tell us about the short-term effects of TM over a 12-week period, as well as only short-term comparisons with prolonged exposure. How these patterns might play out over a longer period is an important question for future research. Secondly, this is the first major clinical trial to use transcendental meditation for post-traumatic stress disorder, and we should always be cautious in applying the results from any single study to clinical practice. Thirdly, for future research, we found surprisingly strong benefits for depression in our veteran sample from transcendental meditation, and this may support a future study that more directly treats veterans with mood disorders. Further, because transcendental meditation may have broad benefits on negative emotions, TM could possibly also be helpful for related conditions such as substance abuse and chronic pain management by improving emotional regulation. The second clinical theme concerns how transcendental meditation relates to other meditation therapies. This study, of course, cannot speak directly to the question of how other forms of meditation might also help veterans with post-traumatic stress disorder. Other studies using meditation, such as mindfulness or mantra meditations, have shown promising results in recent years in studies, but there is presently no data to guide us concerning which meditation might be best for post-traumatic stress disorder or how to best suit a specific form of meditation to a specific patient. Thirdly is the question of how this study might benefit veterans who are interested in receiving transcendental meditation or other meditation treatments in the future. Although the pace of progress varies from one VA hospital location to another, veterans receiving care in VA settings these days have a much greater access to meditation treatments than in years past. There are similarly a growing number of community options for veterans or civilians to receive training in different forms of meditation, with transcendental meditation training centers, for example, available in many cities across the U.S. Lastly, every successful study has a great team behind it, and this project was no exception. I conclude here by sharing the names of the outstanding team members that helped us to carry out this research.